Bismillah ar-Rahman ar-Rahim. Good morning, all. In this video, discuss the sensory neural hearing loss, bone conductive hearing loss, and this to differentiate between them, you have to test Rinne test and Weber test. Rinne and Weber. Simply, how Rinne can be performed, you will bring the tuning fork. You are bringing the tuning fork in front of the ear. This for air conduction. Then you will put over the mastoid. This for bone conduction. Okay. So what is the possibilities from this test? Air will be better than bone. Air better than bone. Or the reverse, bone better than air. If air better than bone, like you see now, if air is better than bone, this means Rinne test is positive. Normal Rinne test, which is positive, air better than bone, the tuning fork in front of the ear is conducting better than when you are putting it over the mastoid. Sensory neural also are the same. Air will be better than bone. While conductive hearing loss, bone will be better than air. When you are putting the tuning fork over the mastoid, conduction will be better when you are putting in front of the ear. How to differentiate that between normal person and the sensory neural? As these two possibilities, air is better than bone. None, air better than bone. I will give by numbers to make it simple. Yani for none, if I will tell the duration is 60 seconds, while in the bone it's 40 seconds. So it's still air better than bone. That's normal. While in sensory neural, it will be also air better than bone, but duration will be decreased in both. Yani air, it will be 20 seconds, while bone 10 seconds. This is how to differentiate. Air will be better than bone, but the duration of conduction, it will be decreased in air and bone in sensory neural, and it will be normal in normal person, which has Rinne test is positive. Now, from this test, we decided patient has conductive hearing loss or sensory neural hearing loss. Now, I will come for the next test, which is Weber test. Weber test, you will put tuning fork over the forehead or over the scalp, and you will ask patient, do you have any lateralization for the sound? Means if patient is hearing equally in both ear or not. If he can hear equally, in both ear without lateralization, this means normal person. Okay. If he hear more louder in sensory neural, he will hear more louder in the normal ear. In sensory neural, and if this, for example, if this left ear, so if this right ear and this left ear, the affection here. So if sensory neural, he will hear more louder if patient has affection here. If patient has sensory neural hearing loss, he will hear more louder in the intact ear, normal ear. While if patient has conductive hearing loss, he will hear more louder in the affected ear. Again, after doing Weber test, you know from the previous test that right ear has conductive hearing loss. Right ear and left. Right has conductive hearing loss. From Rinne test. When I will do Weber, what will happen? Patient will hear more louder in the affected ear. This is confirming your diagnosis. So if you will do Weber test and still patient hear louder in the right ear, means what? He has problem in right ear. So hearing louder in the affected ear means conductive hearing loss. While if patient has sensory neural, if patient has here sensory neural hearing loss, he will hear more louder in the normal ear. So he will hear louder in the left ear. Simply this what I wanted to tell about Weber and Rinne test. Okay. So simply by very nice chart, you can look now. Rinne test. First, if air conduction is better than bone conduction, this normal person. Air conduction better than bone conduction, so this positive Rinne normal person. The difference between these two possibilities is decreasing period. The decreasing in the period. Both decreased. If both decreased, this sensorineural. If both not increased, this normal person, positive Rinne. If bone conduction is better than air conduction, this means conductive hearing loss. Bone conductive hearing loss. This is from Rinne. For Weber, lateralization. Lateralization. If to the midline, means normal, nothing. If lateralization or hearing more louder in the normal ear, this sensorineural. Or the reverse, in sensorineural, patient will hear more louder in the normal ear. While in conductive hearing loss, he will hear more louder in the affected ear. Okay, I hope it's clear for all. This one of the challenge topic in part A and part B, how to understand Rinne and Weber test. Thank you.